Hello, everybody, and welcome to this special Mental Health for All webinar series, #MH for All. This series has been running since April 2020, and I'm delighted to join you today for this session, looking at how can we address the impact of environmental change on mental health. My name is Babita Sharma. I'm a broadcaster and author, and I'm passionate and indeed passionately committed to educating people really a little bit further on climate change and the environmental issues that we are all currently facing, and crucially on how we address them. I'm also a proud board member of UGMH, United for Global Mental Health, and I'm delighted to be with you today to host this important event. Now, we know that our audience today is a very diverse mix of mental health professionals, funders, bilateral governments, UN agencies, NGOs, private sector representatives, and indeed academics and researchers from all around the world. It's really great to see you here with us today. I would also love to hear from you as well through this webinar series. We'd really like to get to know who you are. So just introduce yourselves on the chat function. Share your name and your organization, tell us where you are joining us from in the world. It's always great to know who is out there with us today. Now, this session is being recorded, just so you know, and will be available on our YouTube channel afterwards. So please do direct people there who might not have been able to join this webinar, but might want to follow up with what we're having a conversation with later. Now, if you want to ask questions during this session, you can do so. You can post them in the chat using the question function at the bottom of your screen. There's a little tab there that you can feature. Take the questions in for our speakers, please. I'll do my very best to put them to them. And you can also join the hashtag conversation on Twitter as well. That's MH for All hashtag, alongside hashtag mental health. Now let's get underway. I'm really pleased to introduce our speakers to you today. We are starting with Celine, who is the former Executive Director of the Institute for European Environmental Policy. And Celine is here to give us today a global view of how the environment is changing and indeed some of the implications for mental health. Celine, give us a wave. It's lovely to see you. And our second panelist is Kris from Fiji. Kris, if you can turn on your camera, it'd be great to see you. Kris is joining us. It's 1 a.m. in Fiji, so we're really grateful for him joining us on this European kind of British summertime that we are holding this session on. And Kris is working on gender equality, disability, and social inclusion projects. He describes himself as an angry activist. Kris, you're among friends. And he's going to share with us today his experiences and those of the communities that he works with as they face a wide range of challenges now and indeed looking to the future. Our third panelist today is Davide Ziveri, who's from Handicap International, Humanité and Inclusion, who will talk to us about what we can do about mental health as we try to prepare for and indeed respond to environmental emergencies. Davide is also going to talk to us today about the work that he and his colleagues do from a wide range of organizations all around the world. So Davide, welcome. Nice to see you. And our fourth panelist is Jess Beagley of the Climate Health Alliance. Jess leads the Alliance's policy work, including raising the profile of health in key global climate change negotiations. It's a big deal that, and we're going to talk about that in more detail, and also indeed working with national partners on national policy processes. She also, Jess, provides research and analysis to support I'm going to get this acronym right. There's so many acronyms, isn't there? GCHA's campaign, working on fossil fuel phase out and indeed other issues as well. Jess, welcome. Great to see you. Now, I'm going to remind our panelists to please keep on time because we're really conscious of our audience time participation as well. And like I said a little earlier, we want to make this as interactive as possible. So I will be asking you to submit your questions on the chat function. In fact, you can do that now. We're going to be sifting through that and putting that to our panel of guests as we get the discussion underway. Let's start then. Celine, let me start with you. Welcome to us. And you're joining us today from Montpellier. And let's try and get that global overview. You and I have talked about this in the past together, particularly about how the environment is changing around the world and what the potential implications that has for mental health.
Thank you so much, Babita. It's really an honor to be here today. I have some slides, so I hope that they will appear on screen. Thank you. So what I wanted to talk about today is the relationship between mental health and the environment. And I will focus specifically on low and middle income countries. And when I was preparing this presentation, I thought we needed to speak from a state of crisis to hopefully an age of resilience. And next slide. And I think it's really important to first say that populations living in low and middle income countries are already experiencing the vast impacts that human activities have on the Earth system. And this is already creating a huge shock in their daily lives and a great injustice, as populations in low and middle income countries least contributed to creating those environmental problems and also have less capacity than populations in richer countries to cope with the impact. So the Earth is this complex interrelated system. Our life on Earth depends on its stability and its resilience. And our activities are now destabilizing the Earth system beyond what it can cope with. So this is leading to an accelerating disappearance of species, a rapid degradation of vital ecosystems, the destabilization of our climate, and as well as the accumulation of hazardous materials and pollutants in the soil, the water, and the air. And this destabilization has multiple manifestations, which are already affecting people's daily lives and their health, and specifically their mental health. Floods, storms, sea level rise, droughts, extreme heat, deforestation, and the scale is very large. In 2019, natural disasters affected 100 million people in the world, and most of them are living in low and middle income countries. Next slide. The relationship between mental health and the environment is a complex one. You can see on the screen a diagram showing the interrelationship between the proximate, the less proximate environment and the more distant environment with depression. What we know is that mental health is strongly impacted by major changes in the environment. This leads to several impacts: stress reactions, stress-related physical health problems, which are leading to mental health conditions, which range from depression, anxiety, post-traumatic shock disorder, as well as cognitive and behavioral disorders. This is also leading to strained social relationships, helplessness, grief, fear, linked, for instance, with climate-related displacements or the destruction of the ecosystems people depend on for their livelihoods, but also their cultural practices and religious belief. I was particularly struck by an example in Vanuatu about the grief of a person that saw the tomb of their mother and their wife disappearing with rising water. We also see an increased risk of suicidal behavior due to experience repeated or severe hazards, as well as exposure to rising ambient temperature. And now my last slides. In terms of low and middle income country, what we see is a combination of greater exposure and higher vulnerability. On the left side, you see a prediction of severe heat waves. And this is in the case where we're not able to bend the curve of emissions. And then on the right side, you see an indication of very high vulnerability with mega cities, which are places that are the most prone, for instance, to what is called the urban island heat effect, which does multiply and magnify heat waves. So if we take the example of heat waves, extreme heat events are already occurring almost 3 times more frequently now than in the last decade than in pre-industrial times. And this is going to get only worse. If we look at a specific population region, about half of the population in the Middle East and North Africa, 600 million, could be exposed to annually recurring super or ultra extreme heat waves. And most of these people will be living in urban centers. What does that mean for them? The impact of extreme heat on mental health includes a higher propensity to violence, suicide, mood worsening, and insomnia. For instance, one standard deviation of temperature increases leads to a 4% increase in interpersonal violence and a 14% increase in group violence. Pre-existing mental health alone raises the risk of mortality during extreme heat events 2 to 3-fold. And there are a number of studies, including one in India, which is demonstrating a correlation between the occurrence of heat waves and farmers' suicide. So in sum, low and middle income countries are the least responsible for the ecological crisis, and they're paying a very high price, including for the mental health of their population, and first and foremost, the most vulnerable members of their population. Thank you.
Gosh, that's so much to take in, Celine, and thank you so much for all that data. We're going to come back and pick on some of the points you've just pointed out, but I think this is a really interesting point to bring in our other panelists to for their assessment, to kind of work out if what you're saying, Celine, chimes with their experiences. So, Kris, to you, in terms of your understanding of the impact of environmental changes on mental health, is what Celine's just presented there also something that you see and recognize too?
Oh yeah, definitely. I think what Celine has presented, like we already know this, and our communities are already fighting this. I also have like a sort of presentation of sorts. I'm not slides, but I'm just going to be reading off a script, and yeah, and hopefully I'll stick to with time. And please forgive me, I've got a bit of a cough, so I might like hopefully it's not too disruptive. Yeah, so as Celine mentioned, climate change is the single biggest threat facing humanity, and the Pacific Island region is recognized as one of the most vulnerable to the consequences of the ongoing climate crisis. Our entire region contributes to only 0.03% of total greenhouse gas emissions. However, millions of Pacific Islanders are subjected to bearing the severe impact of climate change, which is undeniably a serious threat to their homeland, culture, livelihoods, and their Pacific identity. Mental health conditions represent a significant burden on the health system. In Fiji, the suicide mortality rate is 9%, making it one of the highest suicide rates in the Pacific. There is little epidemiological data on the prevalence of mental disorders in Fiji, but it is estimated that more than 30,000 Fijians are living with depression, quite a high number when you consider that our population is only 900,000. There is also little investment in mental health. Only 1% of Fiji government's total health expenditure is on mental health. Although climate change is a global phenomenon, its impacts are felt unequally across the world. The same is true for the effects of climate change on mental health, with communities and groups of people that are less able to adapt to climate change more likely to experience the brunt of its mental health consequences. In the Pacific, psychological stress and depression have been noted to rise after cyclones and floods. These could be related to the loss of livelihoods, death or injury to family members, loss of homes to floods and or cyclones, the inability to recover from disasters, threats to food and water security, and the relocation or displacement of populations. These have a ripple effect as there are usually no positive or accessible coping mechanisms when people are under mental health distress. The climate crisis disproportionately affects LGBTIQ people who also face, who due to religious fundamentalism are often blamed for causing natural disasters or used as scapegoats during a crisis. It is also important to understand the context-specific understandings of mental health. In the Pacific, the concept of mental health relies heavily on the varying cultural understandings of health and well-being embedded within Pacific people's experiences and beliefs. These are derived from corresponding Pacific indigenous knowledge traditions, which scholars and activists argue need to be better understood by those working within Western health frameworks. For Pacific people, mental health and well-being encompasses a holistic approach of reciprocity, respect, belonging, genealogy, and relationships with all these entities. These include the land and environment, ancestors, cultures, languages, family, and others, all of which protect and strengthen community, family, and individual well-being. In addition to natural disasters having a direct impact on community resources, the long-term effects of the climate crisis may also necessitate relocation, especially for coastal communities and those on low-lying atolls. The threat of such a move, let alone its realization, has the potential to greatly affect mental health. The relocation or resettlement from the roots of their cultural, psychological, and spiritual well-being has emotional and psychological implications. For example, an atoll state like Tuvalu is likely to disappear within 80 years due to sea level rises. Tuvalu risks not only losing its territory, but also their culture, including traditional practices and sacred sites. Given that there has been a strong emphasis on the need for mental health services to be culturally competent and relevant, it is important to establish and understand Pacific Islanders' conceptions of themselves in relation to climate change, especially given common media depictions of those impacted by climate change. The mainstream representation of Pacific Islanders as climate change victims silences the alternative constructions of Pacific Islander identity that emphasizes resilience and resourcefulness. Pacific Islanders are fighting mental health stigma with limited resources, but also pushing for a localized understanding of mental health that centers local knowledge and expertise. For many community organizers and activists in the Pacific, they feel an increased sense of security and control by taking action to understand, adapt to, or mitigate the effects of climate change at an individual or community level, or even taking their advocacy to the global arena. Taking action to prepare for the effects of climate change can help manage the emotional responses as people come to terms with and adjust their understanding and lives in the context of climate change. Many community psychosocial support programs such as peer counselors already exist to support communities to respond to climate stresses and build resilience. Countries need to dramatically accelerate their responses to climate change, including efforts to integrate its impacts on mental health and psychosocial well-being. This includes investment in treatment models and support for people with climate-related mental health challenges that could help alleviate demand on already overburdened healthcare delivery systems in the Pacific. Finally, there's a growing movement of Pacific peoples taking action on climate justice in the name of survival, resilience, and empowerment. Our powerful call to action is, we are not drowning, we are fighting.
Powerful indeed, Kris. Thank you so very much. Fascinating listening to your perspective here on what we're talking about, particularly how it relates to the environment in which you live, the region that we're talking about, and the people. And I think it's so important to point out those cultural nuances because, of course, mental health is completely an individual thing because the environmental impact is an individual thing and it all varies very much from the country to country, and we have to be mindful of that. We're going to pick out some detail of Kris of what you've spoken about as well, but just want to bring in Jess and Davide as well. Davide, I'll come to you first in terms of if you can lay out your stall for us and just tell us a little bit about how your organization is operating in terms of mental health and the impact on environmental changes and how those two correlate.
Sure. I hope you hear me well. Yeah, great. So yes, my organization, Humanité Inclusion, counts on experience in MHPSS in more than 40 countries, both via integrated service delivery and technical support for inclusive health. However, we acknowledge that just scaling up current modalities may be not enough, facing the depletion of the biosphere. And I prefer to use this term to climate change to start because we refer really to this thin space, to this fragile space where life happens, and that put us face to an existential threat. So I really think that it's the best, let's say, way to acknowledge that is not business as usual anymore. And for this reason, also mental health professionals could feel a bit lost. Actually, nowadays, in my opinion, MHPSS response to the climate crisis is still too fragmented and partial, looking yet for solution, and that's why we are here actually, right? However, we have found an inspiring and unifying narrative under the umbrella of planetary health framework, this emerging field where environment and health are synonyms. And planetary health is helping us, as an organization, for instance, to accepting the complexity of those pathways between environment and mental health, and to fostering transdisciplinarity. That means breaking silos among humanitarian sectors and externally exploring unusual partnership and participation in diverse networks. It's not always easy, but it's so needed. And finally, to reframe the concept of well-being in relation to nature, because we are our environment. But this environment is not the same everywhere. It's characterized by environmental determinants of health and social determinants of health. So the access to environment also is not the same. What does it mean adopting planetary health lens when coming to mental health in operational terms for NGOs, considering that there is no such a planetary health well-being handbook? This is our current challenge. So not easy to answer, but in line with the IAS coordination mechanism, and we are part of the Disaster Risk Reduction MHPSS working group, it means integrating mental health and psychosocial support in all phases of the climate change adaptation. And the fourth point is strengthening the capacity building to have MHPSS staff climate aware everywhere. Rationale for this kind of measures sound obvious and evidence-based when we consider, as it has been said, the impact on mental health for years after a disaster and even before it, affecting not only individuals, as you said, but also entire communities and their social fabric and ties. So because this social suffering, the key is working with the communities more and more, starting from listening their own narrative about what is happening. And I have an example. A few years ago, UNSCR published a very well done community-based MHPSS manual. Many of you probably know that. And there were a lot of action to support communities mourning. But this is not applied for elaborating eco-grief. And probably is because this experience of eco-grief or facing the loss of landscape and biodiversity, for instance, is not yet socially accepted. So I think that MHPSS actors can contribute greatly to shifting social norms. So far, we focus too much on individual issues rather than collective emotions, like anger, as has been said, or moral injuries, and not enough on structural drivers and barriers for inclusive climate action and community solidarity. Instead, by definition, the anthropogenic climate crisis is a human and social crisis in terms of injustice and inequities. So this should be the starting point for MHPSS beyond the biomedical approach to mental health. Those are the considerations we are sharing in our organization so far. To be ready for next emergencies is a long way to go, but we know that we, the global mental health actors, so NGOs, persons with lived experiences, organizations, should reinvest in communities, avoiding pathologizing climate violence survivors, and harnessing the potential of our common effort for social change. Thank you.
So much information there, Davide. There's something that you said that's really struck a chord with me, which is human and social crisis, not a political crisis. I think it's interesting that we say, you know, climate change has almost become something other, hasn't it? In the way that you hear it spoken about in the media, and it's kind of trying to bring it back into human and social hands, because that is where the crisis is of its essence. Thank you very much for that information. And just to you, interesting to think about how we prioritize all of these points and what the priorities are for climate health professionals. I mean, where do we start?
Thank you so much. And yeah, that point about how climate change has become a political issue and health is so good for whether it be mental or physical health is such a good way to bring those, often in many parts of the world, still what's considered to be a far off crisis, which is inaccurate and a false separation. You know, we can't cleave ourselves from the environments that we live in. So I think point number one is to really raise awareness of the links between mental health and indeed physical health and climate change, whatever level that you work at, whether that be local or national or international. We know that health can be a really powerful lever for climate action, and that begins at the community level and extends through every level of decision making. At national level, if you're able to respond to consultations on climate change policy documents or health policy documents, if there are protests that you can be involved with, if there's health messaging that you can incorporate, or climate messaging you can incorporate to build bridges across those typically separated sectors, then that's great at national level. Most of my expertise is at global level, so I will focus on that, but nothing changes at global level without action and awareness raising at local and national level. And it's been really wonderful to work with United for Global Mental Health on that. So I'll speak a little bit at global level about a World Health Assembly resolution that there's momentum building towards on climate change and health, and then a little bit about processes within the UN climate decision-making body, the UNFCCC. So a World Health Assembly resolution tasks member states, so countries around the world, and the World Health Organization with a series of actions. The last time that there was a World Health Assembly resolution on climate change and health was 2008. The mental and physical health impacts of climate change since 2008 have built in a very worrying way, as has our understanding of what those links between mental and physical health and climate change are. So it's really, really crucial to build awareness of this issue at WHA level. We've been working on this, including with United, since August of last year, and we've come up with a list of proposed actions that should be included in this resolution. But we've only, in the past week or so, at the World Health Assembly, had the first member state make a public declaration of carrying forward work on this resolution, and that was the Netherlands. So kudos to anyone on the call from the Netherlands. And yeah, but we've also had lots of private expressions of support as well, including from Kenya, Ethiopia, Malawi, the Maldives, Germany, and Canada. They're really interested in carrying this resolution forward, and the UK, sorry to my own country. Some of the actions that we're calling for in this resolution are around the inclusion of physical and mental health considerations in disaster risk reduction strategies, and in national adaptation plans, which are something that is required for countries to submit to the UN. So trying to join up those WHO processes and the UN climate change negotiation processes. Better surveillance, better quantification of mental and physical health impacts of climate change, anticipating how those are going to change and shift so that we can better prepare for them. And then a really crucial cross-cutting consideration, all of those measures so far are sort of adaptation considerations, but we also need to think about mitigation measures, so reducing emissions. And the big one there is fossil fuel phase out, because of the health impacts of climate change itself, but also fossil fuel extraction and processing and combustion, and the air pollution that results from that, and the impacts that has on multiple dimensions of health, even before we get to the long-term impacts of climate change. It's really important to note that carbon capture and storage, which is often promoted as a solution for us to keep on burning fossil fuels, wouldn't prevent those health impacts of fossil fuel extraction and processing and air pollution from fossil fuel combustion. I will move now to, and also if we think about mitigation, so reducing emissions in the agriculture sector, then healthy, sustainable diets have far better mental health associations than dependence on processed food and junk food, and also a lower carbon footprint. If we move to UNFCCC processes, so that's the United Nations Framework Convention on Climate Change. The work that we're doing at this level is really to make sure that health is part of the discussion on different agenda items. There is no health negotiation stream at the UN climate meetings, the COPs, the conferences of the parties they're called, but health is relevant for pretty much every negotiation item. So one of these is called loss and damage. Losses and damages are climate impacts, and we know how real these are for mental health. And some of the messages that we can be calling for in relation to climate impacts, losses and damages are, understanding of mental health impacts as a loss and damage. Health is recognised very, very broadly within the loss and damage discussion, but that conversation hasn't really been unpacked yet. And to move to adaptation, so building more resilient systems. AOSIS and the Alliance of Small Island Developing States and the Maldives in particular is really championing this notion of adaptation for overall well-being. They include health as a pillar of that overall well-being framing. And for that, it's really valuable to be thinking about the mental and physical health co-benefits of action across sectors. If we can have cities with more green infrastructure, and that's going to be promoting mental health, encouraging people to get outdoors and enjoy the areas that they live in, and promoting social cohesion. And then general adaptation and security from impending climate risks is also going to reduce eco-anxiety. And then in terms of mitigation, we really need to be thinking about the different ways that we can be maximizing health gains. And I've talked a little bit about that already in terms of fossil fuel phase out and sustainable healthy diets. So I'll pause there, but yeah, really grateful to be part of this discussion and happy to answer any questions.
We're very grateful to you, Jess, for being part of this conversation as well, with a wealth of knowledge like all of our panelists have. My mind, I know all of your minds do this all the time because you're in it and you're immersed in it, but mine is just kind of good doing this because there is so much to think about. And it's also the challenge is simplifying it and getting action, agency, urgency, action. That's kind of what we're really talking about here, and having you know, a cohesive narrative when it comes to the climate crisis. Just a reminder, I'm going to now switch it to you, the audience, to ask questions, please, to our panel of guests. We're so grateful that they're with us. And if you can, please submit your questions in the chat function. We had some technical issues with the question function, but please give me your questions on the chat function and I'll do my best to put that to our team. And just also thank you to over 20 countries represented in our audience members today that have joined the webinar, so that's fantastic. Loss and damage. I was at COP last year and it was all about loss and damage. And Jess, it was interesting you spoke about that, because I almost felt that that became the sort of thing that everyone was going to run away with, and that would become the focus, much to the annoyance of all the other things that people have been battling ahead as well. And I know how important that is in terms of the environmental impact on mental health, but where do you think we're at now with that conversation regarding loss and damage? Just to you, and then I'll move on to the others.
Yeah, sure. So the decision that was taken at COP27 to establish a loss and damage fund was a monumental one. It's something that the most vulnerable countries in the world have been calling for 3 decades. So as long as the UNFCCC has been in existence, the devil will be in the detail. We won't know until COP28 in December how that fund is going to be set up, where it's going to sit, what the details of how funding is dispersed, and it's going to be even longer before there are funds in that funding pot. So there's so much yet to be worked out, but even the fact that there was an agreement to establish a fund is a monumental step forward, but we need to continue advocating to ensure that that fund is fit for purpose and does protect the people around the world that are already facing severe health and wider impacts of climate change.
Okay, thank you for that. Celine, a question to you. I'm just trying to work out who this is coming in from, but is there any cause for hope? Good question. Or is climate change and environmental damage inevitable?
Thank you for giving me the easy question.
Was that the easy one? Gosh, if that's the easy one, then we're all doomed. Then we're all doomed.
No, I always think that there's reason to hope. First, because, and you know, we see this by the number of participants. I think there's a recognition both of the severity of the ecological crisis, but also about the fact that mental health needs to be factored in, both as a precondition for action, but also, you know, as a vulnerable population that really needs to be taken care of within the greater ecological crisis. And I think what's seen is that people are, for instance, having eco-anxiety when they start acting and mobilizing and doing something concrete. There is a positive impact on their mental health. And I think what always gives me hope is the number of great initiatives. I mean, we heard from Davide in terms of the mainstreaming of mental health into natural disasters, but also, you know, activists working all around the world to accelerate the phase out of fossil fuel subsidies. And sometimes they're willing to even, you know, get into the risk of getting into prison. So I think humanity is reacting. And I also think that people in low and middle income countries and their communities also have amazing resources And it's interesting, for instance, when you look at indigenous communities, that they are already processing collective grief and finding new ways, new rituals to, take stock of what unfortunately cannot be repaired, but also see ways to build their resilience at an individual and community level. So that gives me a lot of hope. And in a way, the greatest obstacle we have to solving the crisis is when we give up because we think it's just too hard.
Yeah, Davide, I see you nodding away to what Celine was saying. Anything you wanted to add to that?
Yeah, I think that I fully agree, because I think that we need these kind of new rituals, new practices. It's quite new for everyone, but it's the only way that we have to respond to something that is new. And I think that is also somehow answered. There was a question, now I lost it in the flow, but about stigma, about what to do with people who are accused to because of the climate disasters when they are not. So I'm not speaking about a fossil fuel company, because in that case they are responsible. No, but when people are unfairly pointed out. And I think that is connected to what Celine said. We need new creative ways to find meaning, because if we struggle to find meaning, then we can do some shortcuts. And one of these is stigma. And of course, is what we want to avoid. So I think that the mental health and psychosocial support is called to a great challenge, huge challenge, because it's not just that is already very needed, but supporting people, healing person suffering, but really to find meaning, to create new norms, to participate to these new storytellings. Is not the first role that we have in mind when we think at psychologists or other related professionals on mental health, but it's so crucial. And I think that because the knowledge on humans' behaviors and belief and attitudes, we have a role to play in this sense. Maybe it sounds a bit more intangible, but is a crucial step in this moment.
Yeah, I think it's really good of you to point that out, actually, because I think that we're all kind of feeling that is a consensus here. Just moving on to Nana Banyan, who sent this question. Kris, how do we collectively work to remove religious arguments that people of color and or the LGBTQ plus community are the cause of disasters associated with climate change?
Yeah, within the context of the Pacific, that usually happens within sort of like the majority Christian communities, and not all denominations, but like some sort of like Pentecostal denominations. They actually use scriptures from the Bible to actually to blame LGBTIQ people for climate change and natural disasters. We even blame people for LGBT people for the COVID pandemic as well. So I think, yeah, like, so yeah, the blame is everywhere. So I think there's like several ways you can do that. If you're from the Christian community, I think you need to be challenging that when that is being done, whether it's part of your church group or whether it's someone from the same community as you. And I think also, like, you also have to back it up with science. I think, I know, like with climate change science, like it can be a bit of a tricky one because of this whole conspiracy theory around climate change and all the skeptics and whatever, but there
is a conspiracy theory around climate change? Are we still talking about that? I mean, I thought, yeah, unfortunately we are, aren't we, Kris?
Yeah. Yeah, so I think, yeah, so that's sort of like, but there is like accessible facts and resources that you can use to actually, talk about how, yeah, the science behind climate change, sorry. And also, like, I think you also have to look deeper into the issue as well. Like, usually, like, when a preacher or a pastor is actually doing that, there is like sort of like some anxiety around a quest for power within that community, whether they are actually trying to get more followers or whether they're trying to get like more people to join their church or whatever. Because in my context, like, it can be like really, it's a really popular thing to be homophobic. So like, of course you'll be doing that to gain more people into your church. But of course, there are like, small groups and other people like slowly challenging that.
Yeah, I host a parent climate crisis podcast, and it's been really interesting interviewing some climate activists, the youth movement on there, because they are so over this. They are so over the whole kind of hype. I can't say the word I was going to say, but the nonsense around it, right? And the conspiracy theories. They're kind of like, this is clouding us. This is stopping us from moving forward and progressing. And again, the media have a role to play in that, but we need to kind of move it forward. And I think this brings in Denise's question, which I think is really important. How can we get countries or communities which aren't as aware of the impact of environmental changes to even start talking about mental health? Where can we find the support? Jess, that's a really great question, right?
Thank you. And sorry, I was also scrolling through the questions in the chat and in the Q&A box because I realized that I'd missed them. Could you say that one more time?
Yeah, just a question from Denise is, where can we find the support and countries that might not be aware of the impact of environmental changes on mental health? I mean, where do we go? Who do we look to? Who can we ask for help?
Yeah, and I think there's a real challenge here in the resources that are available. I know that United is developing resources on this. The World Health Organization has put out a report on mental health and climate change, I think from August 2022. I'll see if I can find the link in a moment and send it. But the fact is that, you know, this really is an under-discussed issue. There is some information in the most recent IPCC assessment reports in the Working Group 2 report. I'll find the link for that as well. And there's a chapter in there.
Forgive me for interrupting, just say that our team here, Sarah, has just sent the policy brief from the World Health Organization, which is a link there, plus probably about another dozen other links. So if you are joining us on the audience member, scroll back, go forward. There's a lot of information there. It's just a case of trying to find out where to access it. But that policy brief is a really good one to start with, as you just mentioned, Jess. Thanks so much, Sarah. And yeah, the other link that I'll post in a moment is, the Intergovernmental Panel on Climate Change's sixth assessment report focused on impacts and vulnerability from 2022, the COVID time warp stripes again. But I'll put the link for that in the chat too. It is a general chapter on health, but it does cover mental health more than previous IPCC assessment reports. Yeah, and there is help out there. It's just trying to work out where it is and how to get it, but it is there. And I'm really pleased to say that thank you, Poppy. I'm really pleased to say that it is evolving and it is progressing, and UGMH are really passionate about this. I'm really passionate about this, because how can you have a climate crisis and it not be linked to mental health for every single one of us on this planet as global citizens? Davide, what can people do in terms of accessing information during an environmental emergency, as in when it's happening on their doorstep?
Yeah, we don't have solution, and action is sometimes a shortcut to mental health, has been said, because it generates actually more anxiety to be managed. But I think that one point said is really to approach communities, starting from our own communities where we are. That's why the MHPSS in climate change will be finally somehow by design localized, and it can contribute to the colonization of the global mental health in general, because it should be localized. And localized, it means that it has to start from communities. Sometimes communities, as it was said in one question, I wrote it here from Denise, are not maybe aware of that. And it reminded me something in the history of psychology, in the psychology of liberation in the 70s in Latin America, when there was this idea of desideologizing the knowledge of people. But as Kris said before, starting from respect and then listening to how communities understand climate change, because their experience is the starting point, is their reality and the starting point. And then building with them. I know that in the global mental health, we are obliged by the huge needs that we face to have scalable intervention, and are very effective, some of them. So we don't need to reinvent the wheel for everything. We don't need to put climate logo everywhere. Sometimes tools and practices and methodologies are already there, but there are some missing points, some blind spots. And I think that two of those are considering power and violence, that are two social processes, let's say, that I don't hear enough about in climate change and mental health debates, dialogue, and webinars.
Yeah, good point there. Celine, go ahead, because I know I can see you're constantly agreeing with Davide there, but it's some really interesting points that he's just raised.
Yeah, absolutely. Because we also know that climate change, but also growing scarcity of critical raw materials will become an even bigger contributing factor to conflict, either at the community level or between different countries. So, you know, integrating that dimension within both climate change policies on adaptation and mitigation, but also in mental health strategies is important. Second thing I wanted to say is, yes, United will be putting out more materials. We're just finishing our research, which has a lot of references. And I hope that working together with the partners of United in low and middle income countries, we can put out some materials and advocacy toolkit that would be most relevant to the problems they are facing. That leads me to my third point. I think in my experience, because I used to work for Oxfam, people at the front line are very aware that their environment is changing. They might not use the word environment, they might not use the word climate change, they might not use the word biodiversity, they might diverge in what they think is the cause, but they are really aware that this is happening. And likewise for mental health. I mean, people might not be saying mental health as such, but certainly you hear people talking about their grief, you know, the fear about the future, and wanting to protect their children from what they see is the end of the world they know and they see. So I do think it's also about a question of semantics and trying to find the right spaces and the right language that will allow and empower people who have a lot of knowledge in the front line to express how it feels for them, both individually and at a community level.
I'm so pleased you mentioned the word language, because I think that is so key when we're having these conversations, is how we address all the points that you've all made, but also how the language that we're using, whereby we are not fueling the eco-anxiety, but in understanding it and giving it a place for it and appreciating it a bit more so. Do we have to be angry in this space, Kris? You call yourself an angry activist. I mean, how angry do we have to be?
Oh, yes, definitely. I think we have to be angry about the state of affairs, especially in relation to how we're sort of moving the climate change agenda. As I said, I think, you know, people on the front lines of the climate crisis, people in the Pacific and other people in the global South, we've had enough. And, you know, like our governments, our community organizations, our activists have been pushing the agenda, but it's not enough. So I think this is where the global north comes in, and it's good that, you know, that we actually have, you know, people and organizations in those countries that are actually in solidarity with us. But I think we definitely need to be doing more because I hope we can all channel our anger into our activism, into any different sort of spheres of influence that we have, whether it's challenging, you know, climate change skeptics, or challenging religious beliefs around climate change, or whether supporting someone who has some mental health related issue in relation to climate change. So I think, yeah, we all have a role to play, and so yeah, let's challenge that anger into our activism for climate justice.
Davide just sent me a message saying, can I react to what Kris is saying? So polite, jump in there.
Yeah, joining him, because I really think that answering to our questions that pop up about hope, we need to, I think that hope is there, could be there, but we cannot avoid the fact that it's conflictive issues, and it will be a struggle. And so we need anger, as Kris said, because it's motivational, first of all. And the good news, if we state that the climate crisis is a conflict, and it's not me saying that, but there are, I think it was Bruno Latour, the French sociologist, say that it's a war for many reasons we don't have time to develop here, but it's conflictive. The good news of this point is that MHPSS, for instance, in humanitarian setting, has gained a lot of experience in managing and working in conflicts. So we are not starting from scratch.
No.
But we have to refer to those kind of topics more than, I think, only a classical mental health and individual level.
Okay, thank you very much for that. Jess, a question to you. I'm conscious of time here. We've only got about 8 minutes or so, so try and whiz through this if we can. Jess, how can the World Health Assembly, the WHO, play a role in advocacy and lobbying in order to stop the climate change pollution in developed countries, who are the major contributors of waste materials, industrial, medical, and also transportation to pollute the environment?
So I'd already talked a little bit about how, even the process of having a resolution is really vital for lost the ability to speak, raising awareness of
we often do lose the ability to speak on issues like this, I have to say, because the mind just kind of goes, whoa, doesn't it? So much to think about.
But a rabbit hole that I would love to go down, aside from that quite general function of WHO processes, is around the success of the health community in regulating other unhealthy commodities. We've seen, huge progress made on tobacco control, less but still really important progress made on unhealthy foods and beverages, on alcohol, and fossil fuels are the other big unhealthy commodity that the health community hasn't waded in yet, with the same force as it has on those other areas. And I think there are lessons from tobacco control in particular that we can apply. If we look at the Framework Convention on Tobacco Control, there's a clause in that that specifically prohibits the participation of industry in tobacco control policymaking. And if we go to COP, we see delegations that are larger than the majority of country delegations that are comprised of representatives from the fossil fuel industry. So it's chalk and cheese in many ways. Other lessons that we can learn from other unhealthy commodity industries, regulating them rather than from them, are around fiscal policies, whether that be taxation or subsidies, and making sure that taxes are commensurate with the health burden of that commodity, and we certainly don't see that for fossil fuels. About 6%, potentially slightly more, of global GDP is currently used to subsidize fossil fuels. In G20 countries, as of about 2014, the health costs of fossil fuel subsidies by G20 countries were 6 times the cost of those subsidies. So we are literally subsidizing health costs. And then finally thinking about regulation of advertising. There is a movement building on that for fossil fuels, really strong leadership by the Netherlands, also from Australia and some other European countries too. So I'm sorry for my fossil fuel rabbit hole, but glad to have had the chance to talk about that. Thank you.
We're glad that you took us down there. Thank you very much, Jess. And I'm currently on an island with Davide and Kris on the Angry Mountain that's kind of just getting higher and higher, because everything I hear is just, it's frustration. But of course, we have to channel that in the right way. Balak has posted, we need strong advocacy for institutional development at policy, as we have insufficient technical HR psychologists and clinical psychologists available at county level, country level perhaps, to respond to the patients timely, which increase the mental disorders at community level. Very key point there, because without the HR policy within the workplace, I mean, it's where are we going to go from there? We have to really have it. I don't know, where do we go from there? Kris, Celine, Davide, Jess, check in there for me if you can. Anybody got a kind of magic wand for this?
I'm not sure I have a magic wand, but certainly I think it's key for the wider health community to think about how do you protect mental health in a changing environment. We will have an increased disease burden, and obviously that means building the resilience, but sometimes one hears too much about building the physical resilience of facilities, and not so much about, how do we train, how do we support the staff? I mean, how do we care for carers in situations where we will have repeated shocks and where shocks might become the new normal? Because obviously, if you're not able to cope anymore as an individual, you're not going to be great at helping others that are facing the impact of the same disaster, because you are in the same location. So I think that's where we need a lot of innovation, but also increased funding. Rich countries created this problem. They need to help resolve it. And first and foremost, they need to increase climate finances specifically towards strengthening the health systems. and work with health professionals to make sure that all this money doesn't go just in infrastructure, but that we invest in people.
Yeah, good point. Conscious of time here, so I'm just going to ask if I can all of our panelists to summarize in their thoughts in a tweet length, if we can, of course, because it's all social media apps, aren't we? To complete the following sentence, if you can, for me. Addressing the impact of environmental change on mental health means what? Addressing the impact of environmental change on mental health means, Kris, what does it mean?
Yeah, well, apart from being angry,
Yeah.
I think, yeah, what others have said, and also like, like in terms of, the reality of climate change and the communities that are vulnerable, the regions that are vulnerable, I think we really have to center the voices of the most vulnerable and support like grassroots community mobilization in tackling climate crisis and mental health, because often they're the ones at the community level, at the grassroots level, they're the ones that best know the community, best know the issues, and they're the ones who, are able to work together with resources and make things happen. So it's really important that we center those voices and also and acknowledge their expertise.
That's longer than a tweet length, I think.
Yeah,
Kris,
it's very much long. Sorry about that. Yeah,
I'll give you that one. It's now, it's coming up to 2 a.m. You're allowed that one. Davide, let me remind everyone that what we're asking here, just to complete the sentence. Addressing the impact of environmental change on mental health means
being aware of the treatment gap that has been mentioned, but remembering that we are not aiming treatment, we are aiming social change, or at least contributing to social change. And to do that, that is out of the 140 characters, but we should working with both emitters community and vulnerable communities, and also on the conflict in between.
Thank you. Jess?
I think I can make 140 characters.
Let's just presume you've got premium subscription here and you're one of those blue tick holders. So I'll allow you a bit of leeway there.
Means breaking down the artificial silos that have been constructed and reflected in climate and health decision making. We need to break down the silos between those two currently separate processes.
Yeah, break it down, get closer in that conversation, I think. Good point. And Celine, please.
I think it means channeling not only our anger, but also our love and our thirst for justice to really tackle the root cause, protect those that are the most vulnerable. And last but not least, regenerate nature, because there is one thing that is shown in the literature again and again, is that going into nature and having access to nature is a strong contributor to good mental health.
Thank you. I just want to get a sense from our audience that are with us. If you are seeing the impact of climate change and mental health on mental health, can you do a thumbs up on the reaction button? I'm just keen to find out if anybody in our audience is kind of seeing that already. The impact of climate change and environmental change on mental health. Well, there we go. I think it shows that we are having this conversation at the right time, aren't we? To all of the panelists, thank you so very much. To Davide, Celine, Jess, and Kris, we appreciate your time. We could do this for hours. We could do this all day. In fact, we could do our own COP, couldn't we? We might well do better. Who knows? But there's so much to talk about, and I know that you're working incredibly hard in your own spaces to do that, so I just want to thank you. And I know that you'll carry on sharing information with us at United for Global Mental Health and the Global Mental Health Network, and also wider as well. So to all of you, thank you so much. And also thank you very much too for joining us today for this webinar. To our audience, it's great to have you here. Like I said, over 20 countries represented, which is great. Just a reminder that the next webinar will be in July, not June. Registration link for that is in the chat. And instead of a webinar in June, we hope that as many of you as possible will be able to make the GMHAN meeting, the annual meeting that's taking place in Cape Town. That's on June the 28th and the 29th. If you're there, look forward to seeing you there. And just so you know that as a virtual networking space after this called Circle, Details are going to be posted in the chat function, and you can carry on the conversation in Circle in that web form there as well. But in the meantime, thank you all again for being part of it. Oh, and I should just say, by the way, in Cape Town, the meeting will be hybrid, so you'll be able to join in if you can't make it in person as well. But from all of us here on this latest webinar series, thank you so much for being part of it, and we will see you again very soon. Goodbye.